My name is Tayana Tai. This is Biology 211, Human Anatomy for Professor Jones. My disease presentation is on chronic kidney stones disease. Introduction of the disease, chronic kidney stones. This is a disease mostly linked to diet or lifestyle such as excess body weight. In some cases there is genetic linkage. Kidney stone disease is a urological disorder that consists of tiny crystals of solid mass formed within the kidneys in which there may be one or more stones in the kidneys or ureters simultaneously. Symptoms include flank pain, it can be the backside where the kidney is located, blood in your urine, hematuria, intense cramping pain, renal colic, UTI, urinary tract infection, or urinary tract disease, dilation of the kidneys, hydronephrosis, urine flow blockage, vomiting, fever, and chills. Symptoms of kidney stones depends on location, whether it is in the bladder, kidney, or ureter. Those symptoms can be experienced all together or some of them occurring at the same time. The symptoms may come and go or stay for long periods. These symptoms are awful, therefore a mild case would be not having many symptoms at all or your stones are small enough to pass. Severe cases can occur when stones are too big to pass or blocking urine causing infection or kidney disease. Symptoms can be the same as the ones mentioned previously or more specifically pain that will not go away. These symptoms are intense, involve suffering, and requires treatment for pain. Therefore, treatment and time lost from daily responsibilities, school, or work demonstrates cost imposing an impact on the patient's daily quality of life. Kidney stones form when your urine lacks a substance that stops crystals from attaching to each other, or your urine contains more crystal-forming substances, uric acid, oxalate, calcium, than fluid in urine can dilute. Your urine has a variety of waste dissolved in it, and when there is too little liquid and too much waste, crystal can form and attract things that will form a solid and can continue to get bigger unless it gets passed out of the body. Usually chemicals such as oxalate, urate, xanthine, cysteine, calcium, and phosphate are eliminated by the kidneys in the urine, and if not, stones begin to form in the body. The disease can be caused by certain diets, obesity, dehydration, family history, medications, medical conditions, or digestive diseases, and surgery. Long-term effects would be you risk developing chronic kidney disease, and permanent kidney damage or spreading germs into the bloodstream, or having another stone. Short-term effects would be pain and symptoms, inflammation of the kidneys and ureters, or urinary infection. So, criteria that is used to make a diagnosis of the disease would be abnormal calcium, phosphorus electrolyte, and uric acid levels, examination of the stones to confirm the type, red blood cells will be present in urine, or they could be present in urine, to test and examine kidney stone disease, blood test to check for infection and function of kidneys, urine test to see signs of infection, imaging tests such as CT scan, kidney ultrasounds, or abdominal x-rays to see size, location, and shape of stones. This disease is common in the U.S., affecting 1 in 11 people. 600,000 Americans suffer from kidney stones every year. It affects 12% of the world population. In Indian population, 12% are expected to have stones, but 50% lose kidney functions. Global warming has been a cause of the increase in the past decades in both developed and developing countries. It is more frequent in men than in women with the age of 20 to 49 years, though growing amongst women. It affects all races, though it is more prevalent for white people, specifically white men. There is an increase in chronic kidney stones disease in women, black people, and Hispanic people. There are also disparities in surgical management, stone composition, urine biochemistry, health-related quality of life, and administration of analgesia. That's by Crivelli, 517. So, this disease was first discovered in 1901 by E. Smith, an English archaeologist, and it was first discovered first bladder stone was discovered in Egypt from a 4,500 to 5,000 year old mummy. Treatment does depend on the type of stone and its severity, though kidney stones usually pass through your system on its own. You can take ibuprofen, naproxen, and narcotics, which can be very effective for pain treatment of the disease to decrease pain level. Surgery will be required if the stone is too big to pass on its own or stone is blocking urine flow, causing kidney damage or infection. Some natural remedies can include drinking a lot of water, dandelion or licorice root, eating a unique diet for your health, kidney stone tincture supplements, and meditation. Support groups. There are online support groups and ways to chat online with a licensed mental health professional. You can use sites such as NephCure and KF Peers 18%, Psych Central 7 Cups, and the CDC also has tips for coping with stress and anxiety. This is a video that demonstrates, this is a uroscopy, and it demonstrates how the kidney stones is being removed when they are too big to pass and when they're blocking urine. So this condition can be temporary and you won't have any more stones afterwards, or it can reoccur throughout your life and cause damage that is permanent, usually if left untreated. Some stones may stay in place for years and you won't even know they are there. In most cases, the disease is short-term, in which kidneys can lose some function if there is blockage from a stone or until or if another stone is formed, although it can be long-term and you have symptoms that affect your day-to-day life. If kidney damage does not occur or another complicating medical disease, then life expectancy is about average. Chronic kidney stone disease formation is a process that is multifactorial and complex, including factors that are intrinsic, such as sex, age, and heredity, along with extrinsic factors such as dietary, climate, geography, water intake, and mineral composition. The disease has been around for a long time, although the name came about later, and there are a variety of names for this disease through different origin. Kidney stones vary in size. They can be grain size or over 6 millimeters. No matter the size, you can experience pain as the stones pass. There is no estimate for the exit process. It just takes time and depends on when your body wants to push the stones out. Drinking lots of fluids helps the process usually. I'm saying that from experience because thankfully mine were able to come out in a couple weeks, but I've talked to other people that had it, and it takes months for them. So it really just depends on you. And yes, I was drinking a lot of water, and they said even lime water helps. A combination of drinking enough fluids, avoiding urinary infections, food plan based on your stones, and specific treatment with medications will significantly reduce or stop new stone formation. This disease can result in symptoms, but also may not. Kidney stones are detected using blood, urine, and imaging tests. When stones cause blockage, treatment can include surgery, endoscope removal, or shockwave therapy. Can also be treated with pain medication, surgery, certain foods, or natural remedies depending on your size and type. Chronic kidney stone disease does not shorten your life expectancy, but depending on your lifestyle and family history, effect can be long-term because stones or pain may be ongoing or even day-to-day, but this disease can also be short-term, and pain and stones can be prevented sometimes. This is a common disease that affects many people in the U.S., all ages, races, and gender. This disease travels around the world as well. There are also health disparities that make this disease harder for Black people, Hispanic people, other people of color, and women to endure. Here are my 4 references. Thank you.